Hi, this video is the demonstration of the FUT Linear Scar after a few year follow-up. And some scar vary from one individual to another, and some of them can be better than this and some of them can be worse than this. It can be stretched. And we will use the latest technology called tricuspid closure, double layer, and trying to squeeze the hair through the scar to make it a little bit less visible. But the strip scar will always be visible if you shave the head, and you cannot wear your head shaved. Where the FUE, you have tiny dots of scar, allow you to wear your hair shorter. There's always pro and con for both FUE and FUT, and I perform both FUE and FUT. So, I don't push patient one way or another. The more you understand about the side effect and the scar and all those stuff, then the more educated you are, and the more you can make a decision that's well informed. Again, this is the FUT Linear Scar, and you can see it running from one ear to another ear. There's pro and con for both. The FUT, not just a linear scar, more visible, but the FUT will have to cut you open. That means it's more side effect, more painful to recovery than the FUE, and it has a linear numbness along the linear scar, not the whole head. Again, it's more painful doing this. Both itself, the FUE and FUT, are doing outpatient and you go home, so they are minimally invasive surgery. But those are the downside of the FUT or the strip method. But the benefit of the FUT are, number one, it's a lot cheaper than the FUE, almost 50%. The number of grafts you can harvest is from 4,000 to 6,000 grafts per day. Versus for the FUE, you can do 25 to 3,000. So the FUT, again, I perform both the FUE and FUT. The FUT are more specific for advanced hair loss, class 5, 6, or 7 hair loss, where you need to move a large number of grafts per day. Where the FUE, you can do for mild to moderate, because you can do 2,500 to 3,000 grafts per day. Although I can go beyond 25. But you can do it for advanced hair loss too, for using the FUE, but you're just going to need multiple surgery. In terms of the result, the density, I'm going to give you both FUE and FUT. You're going to have good result, and you just look through my work. But the difference is, if you compare my FUE to my FUE is around 5 to 10% less density than the FUT, but you can't tell with the eye. Again, one clinic to another is different. Sometimes my FUE is better than other clinic that does FUT or FUE. So this is the demonstration of where the FUE, the pro are, it's less invasive, less scar, less visible scar, less painful, less bleeding. But the downside of FUE are more expensive. The number of grafts we can do is less, 2,500 to 3,000. So it's more preferable for mild to moderate, although you can do for advanced hair loss. And the other thing is, you can have good result with the FUE and FUT with excellent density. But if you compare my FUE to my FUT, it's 5 to 10% less density than the FUT. So this is the FUT Linear Scar, and demonstration, more than a year follow-up.